Welcome to another episode of Weight Loss with Dr. A.
Hello everyone and welcome to the episode of Weight Loss with Dr. A. On this episode, joining me is Erika Martinez, and she is our nutritionist here at Endohospital. And today, I wanted to invite Erika here for a very, specific subject, and I know she's going to give you a lot more information, and I can pitch in with my 2 cents with some additional information regarding sometimes some confusion on low-carb diets and keto diets, and maybe the differences between one and the other because they're not the same. So, Erika, welcome. How are you doing?
Thank you. I'm doing good. How are you doing, Doctor?
Doing great. Feel great. So, let's start off with maybe you can help us out with maybe the definition on one low carb versus the definition on keto.
Okay. So it is a very common mistake that patients think that just because they are going into a more low-carb lifestyle, it means that they are doing keto. As well, I do see Atkins popping up pretty often, and patients get very confused because they think that Atkins is high protein, and then keto is as well high protein. A lot of patients do have this idea that both are high protein. But in reality, keto is high fat, very low carbohydrates, and very moderate protein.
Correct.
As well, low carb diets are pretty much, there's not an exact definition. It could range of 10% of your calories coming from carbs all the way to 45% of your calories coming from carbs. So let's round it up to maybe consuming about 45 grams to 100 grams of carbohydrates a day, which
Correct.
is low compared to the regular intake.
All right, and we've spoken before on the subject on carb counting. And we've talked about that before, so you may want to check out that episode on nutrition labeling, how to count the carbs, what's the total carbs, what are dietary sugars, what are alcohol sugars, and what's your net count, right? Because that is what Erika's talking about. You need to look into how much or how many carbs you are eating daily. All right, and some people, indeed, I agree with Erika, some people say, maybe you just have to cut your carbs to under 100 grams per day. Well, the truth is, it varies from patient to patient, and we were having a short conversation before cameras here, before the recording, on how long does it take me, Erika was asking me, how long does it take me to run or jump into or get into the stage of ketosis. And this varies from patient to patient, and I know my body, so I know that it usually takes me about 5 to 6 or 7 days, normally 5 days. But I can jump into ketosis after 3 days, and I can notice it, and I go the full 9 yards. It's all or nothing. It's everything or nothing. So I'm really, really strict on what I do, and I can really jump into ketosis fairly quick if I want to by doing mainly fat, absolutely zero carbs, so mainly fat, and a low calorie or a deficit. If I do that right away, I can jump into it in about 3 days. So that means my body depletes completely of sugars in my body, glucose running around my bloodstream, and glycogen in my liver. And after that runs out, my body switches over to forming ketones in my body, and that's why it's called keto diet. And ketones are used as energy. So your whole body is using ketones as energy, and those are coming from burnt fat. All right, so, but the truth is everybody's different. Maybe it can take you more time. Maybe the amount of carbs, of course, everybody's different. Maybe you need going all the way down to 75. Maybe you need to go down to 45. Maybe you need to go down to all the way to 30 because your body's different. So everybody is different.
Everybody's gonna have a very different micronutrient distribution, and I think that's why Atkins, it is considered a low carbohydrate diet, and it is very successful for a lot of patients and for a lot of people in general, because it reduces the amount of carbohydrates for a couple of weeks, but then you start reintroducing them until you notice on your body how much you're able to tolerate without gaining weight.
Correct.
And I bring Atkins because I do hear it pretty often. Keto and Atkins are the most common ones that I hear amongst patients.
True. Now, let me ask you this, because this is sometimes a mistake patients do. If you do low carb, but you're doing a lot of protein and you're not going into deficit, you're actually going the other way. Will you lose weight?
So pretty much what we want to achieve with any kind of diet is a calorie deficit.
Yes.
If you don't have a calorie deficit, you will not be able to lose weight. Because as we said I think it was on the first podcast, even if you eat healthy, the healthiest food, if you are overeating, you will never get to weight loss.
Thank you. That is a takeaway message for you. Write it down. You need to be in a deficit diet. All right. I don't care if you guys want to do all fat on your macros. I don't care if you guys want to do like really high protein. But if those amount of calories a day of protein, only protein, are exceeding your calorie needs daily, you will not lose weight. On the contrary, you're going to gain weight. And the reason is this amount of protein in your body the extra amount your body doesn't need, will turn into glucose, it's called gluconeogenesis. It's genesis, formation, glucose, sugar. It is the formation of glucose in your body, sugar in your body, due to those proteins. All right, so you need to understand that, just eat high protein. I'm eating high protein. I'm staying away from carbs. I'm staying away from fats, If you're focusing on doing that, it's not going to work for you. It's not going to work for you. And you will have some side effects from the excess amount of protein. So, same goes the other way. Well, I read on a blog that doing a keto diet involves high amounts of fat. Mm-hmm. And I see people putting butter in their coffee, mm-hmm. and
bulletproof coffee,
and doing a whole
mm-hmm.
bunch of stuff that it's just, what are you guys doing? It just amazes me. But
mm-hmm.
they think that because they're doing only fat, which is you can bring your macros on your fast high. It's just, if you still need to understand, you need to add the amount of calories you're doing daily.
Yes.
Because if you're surpassing that, you will not lose the weight, and on the contrary, you're going to gain weight. Yes. So calorie deficit. So I'm going to make a short parenthesis here. That is how the sleeve works. All right, that's the secret. Sleeve works with calorie deficit. All right. So a normal person is eating with their whole stomach. We reduce their stomach capacity 80-85%. And guess what? They're going to go into calorie deficit. Yes, they're pretty much able to adapt to any table they sit to, but they're still eating a deficit. They have a deficit in their calorie intake. And overall, daily, day to day, every day, they've got their emergency brake always on, mm-hmm. and they can't surpass it. So they will always be on a calorie deficit, and that's the secret with a sleeve. All right. What we're teaching you here, with Erika's saying, is you can jump into ketosis. You can. What we're playing with the sleeve is mainly math. Mm-hmm. Calorie deficit, simple. You go under your needs, you lose weight. You go over your needs, you're gonna gain weight. Mm-hmm. So that is math. We're talking about math.
You're doing the math for them.
Exactly, that's math. What we're teaching you today here is low carb versus keto, ketosis, ketones, and everything. We're talking about chemistry. Mm-hmm. So it's very different. But in the sleeve patient, we can mix it up. We can go into calorie deficit math and then do keto diet, ketosis. And we're doing chemistry, and those patients do amazing. Now, do you need a sleeve to go into ketosis?
No.
Everybody can do it, you know?
Yes.
And we were talking about that. I don't have a sleeve. It takes me about 5 days to jump into ketosis. I feel it, but I also test it. You might want to talk about that, because it's not just about feeling it. You got to test it, right?
Yes. So pretty much what we're looking for in a keto diet, just to be more specific, a keto diet is pretty much 70 or 80% of your calories coming from fat. About 20% is going to be coming from protein. You don't want to overdo it because, again, like Dr. Aid said, you're going to be using that protein as glucose if you overdo it, and it's about 5 to 10% that is left that you will be consuming carbohydrates. Now, when I take the time to actually design a keto diet for each patient, it is a little bit more challenging than it seems. I mean, it's hard to only be consuming 25 grams of carbohydrates, because even lettuce have carbohydrates, tomatoes have carbohydrates, even the berries that are pretty recommended during keto, everything has a small amount of carbohydrates. So even dairy, that I see a lot of people using heavy whipping cream and all this stuff that is mostly dairy based, it has carbohydrates in it. So you have to be very careful. And if you are not careful with the protein, which is the major problem, if you don't really measure the amounts of protein that you're doing, you can overdo it pretty quick.
Correct. Yes. And that's very important for you guys to understand. Staying or trying to stay under 30 grams of carbs a day, as Erika's saying, and I've done it. I've done it for some time. It's challenging, guys. It is challenging. What I like to use is, if you don't have access to somebody like Erika, your nutritionist, to come see her and everything, or contact her online, I track my macros with my phone application. You know, MyFitnessPal is one of them, and MyFitnessPal helps me track whatever I'm eating, my macros daily, and everything. Sometimes you get a little obsessed with it, and you're punching in and putting everything you're putting in your mouth. It could be lettuce, it could be whatever. And true, the thing is, it opens your eyes nice and wide to show you that pretty much everything has carbs. And you may say, well, I'm going to be eating happened to me today at lunch. I want to order a salad, you know. But salads are healthy carbs. They're mainly healthy carbs, as you're saying. You name it: carrots, lettuce, everything, broccoli. Everything has carbs, and it's talking about carbs. Now, I was about to do that, and then you're talking about, well, what do I need to do right now? I want to lower more my carb intake. So what I really did is just order a steak. That's it. But you got to be very careful with the amount of steak, because if you overdo the steak, and you're overdoing the proteins, and protein will be converted into glucose. So it's a never-ending fun game here.
Yes, and I think that's why a low carbohydrate alternative became an option, because keto is low carb, but low carb does not always equal keto.
Correct.
That's a very important difference. So there's a very important thing that we need to highlight with this topic, and is the fact that keto is low carb, but low carb doesn't always mean keto. There's very different diets that are included into the low carb umbrella. So for example, we have the carnivore diet, which is pretty much just eating meat. We have the Atkins, or the vegan version of the Atkins, which is the Eco Atkins. We have the paleo diet, which also could be going into the low carb umbrella, because you're mostly focusing on greens and berries. and the rest will be your fats, meats, and seeds and nuts. And as well, there's other ones which is pretty much with this idea that you need to lower your carbohydrate intake, but not to the point of being so restricted with 35 grams or 25 grams of carbohydrates a day. Something that I do notice, there's two things. One thing that I notice is when patients want to go low carb, they start losing weight because they cut the calories right away, but they don't really substitute it with anything else. That could be a good thing because you are creating a deficit, but as well, if you're just cutting calories and not really replacing some of them with fats or with protein, this is when you get to the point of the keto flu, which is something that we talked before. So pretty much you start feeling a little bit sick, you start feeling lethargic, and it's pretty much because you decompensate your body right away. But you can start pretty slow. You can do a slow transition into that.
So just to remind patients that just because you're going low carb, it doesn't mean you're in ketosis, all right? And you're burning fat, okay? This means that you can come with your carb intake to 100 grams a day, and you're still not producing ketones, and you're still not burning fat. You can bring it down to 75 grams, and it's not effective. Maybe for someone it is. Maybe for your body it isn't. Maybe you can come down to 55, and then your body jumps into ketosis, and then you're doing a keto diet. All right, so keto diet is a form of a low carb diet, but the other way around it isn't. If you're doing low carb, it doesn't mean you're in ketosis, all right? So if you see all the posts I do on my Instagram of what I eat, the idea is I give you of a low carb meal, and that is the reason I don't put hashtag or place the word keto on it, because I really don't know if you're in keto. I'm just giving you an idea of what a low carb meal could be. And if you do that with time and under a certain amount of grams, you can jump into ketosis. All right.
And as I said, I mean, you can still have success with a low calorie diet, or a low carb diet. But then the question arises, so which one is better? Which is the question that I get
really
most
good.
frequently.
Yes.
And pretty much, as I always try to remind patients, there's so many diets that exist. There are so many diets that you can pick from, and it is because you should find one that you can actually adapt and that you can actually do for a long term. You should not just punish yourself and go into a very restrictive diet if you know that in a couple of years or even months you will not be able to do it anymore and you're gonna rebound. So pretty much you want to find something that it could actually adapt, or that you could adapt a little bit easier into your life. So, and there has been many studies that compare keto, low carb, and low fat diets, which are the most common ones, and you can lose the same amount of weight in the 6-month period that usually these studies are performed for. So you can lose the same amount of weight, but you just need to find something that you feel comfortable doing.
Yes, I love the idea. It's called sustainability. Something that you can sustain for a prolonged period of time, or make a habit, or make a lifestyle even better. That's what you need to follow. That's what you want to do, because that will give you the best long-term results. And guess what? It adapts to your lifestyle. It adapts to you because it fits your own atmosphere, and you can keep on it and work on it and feel good about it, right? So something I want to bring up, it's very important. So we talked about which diet is better. That's one thing.
Yes.
Now I want to ask the question differently. What diet is better for losing weight or burning fat? No, not losing weight, burning fat. All right. Is it the keto diet, or is it just the low carb diet?
A keto diet, it is way more focused into burning fat. because I mean, there's gonna be, as we talked before, there's gonna be the first week or so that you will be losing mostly water weight because you are getting rid of all the carbohydrates in your body, which bond to the water. So you're gonna be losing water weight for a couple of days, but after that you are actually gonna be burning fat. And if you are implementing exercise into the equation, it's gonna be way more effective.
Fat burning machine. Definitely.
Yes.
Definitely. Well, I think we really, anything else you want to add to it?
Not really. I mean, I do always get this question. I had a patient the other day that she had the sleeve done, and she asked me, she was telling me that she was very successful doing Atkins, and that she wanted to continue doing it, but then she felt very confused because she saw everyone in the Facebook group saying that keto pretty much changed their life. And she was like, oh, but if I was successful with something, does that mean that I still need to try out keto just to make sure that I have enough results? And pretty much I respond what I just said to you right now. Calorie deficit, regardless of how you get to it, either through exercise or food or both, it's gonna give you results. You need a calorie deficit in order to lose weight, regardless of the path that you're choosing to take.
Love it. Beautiful. Summed up right there. All right. Well, if you have any questions, you know where to reach us. You can find us on our social media channels. You can find Erika on her Instagram page. You can find me on my Instagram page. And Erika, thanks so much for this lovely presentation. Really, thank you. Very informative. And if you have any questions, just let us know. We'll be glad to we'll answer them here or answer them on the AskDrA show. And Erika Martinez, I'm Dr. Alvarez from Endobariatric, and we'll see you next time.